Hi everyone, welcome to everything you need to know about residency interviewing from A to Z. My name is Dr. Manik Madaan. I am currently the world's most followed USMLE and match voice. And in this video, I will uncover the secret process of how residency programs interview you, how do they evaluate you, so you can reverse engineer that process to make sure you rank to match. So we'll be first going over what matters the most in matching. Secondly, we'll be talking about what does the interview format look like for residency interviews. Number 3 would be interview evaluation and calibration. What are the criteria they're using to evaluate you? Number 4, we'll talk about levels of interviewing. Number 5 is the highest level of interviewing, which is what I call as advanced interviewing. And number 6 would be the types of interview questions that you need to know about that can come in your interview so you can answer them. 7th will be calibration, which is how do you calibrate to each different program so that you're making sure you are connecting with them so they are ranking you well. And lastly, there'll be a free gift for anyone who stays till the end. So let's start with the first part, which is what matters most. So for the past few years, the company that runs the match called the NRMP has run multiple surveys to program directors asking them, what do you value the most whenever you're ranking applicants? What do you think matters the most in moving the needle towards somebody matching or not? And all of them came to this one answer, which is called as fit. They said that the number one factor that decides whether somebody will match in our program and whether we'll rank them or not was whether they fit well into our program or not. So what do they mean by fit? Fit is basically how well you get along with the residency program. So if you were to think of the residency program as this incomplete puzzle, you are the missing puzzle piece for them. Residency programs are going to spend at least 3 to 7 years with you, so they better know that you're gonna get along with the program, because if you're not gonna get along with the program, that is going to be the worst case scenario for them. And one thing I really want to hone upon here is that fit does not equal how good of a candidate you are. You could be the best candidate on paper academically, let's say, but if this is a program that isn't really that academic and is more community and you do not talk about that facet of you, the program is not going to rank you and you will not match there. So a fit really depends upon who you are and who the program is and how well you are aligning together. And I'm going to teach you how to do this as well, how to make yourself fit different residency programs in an authentic manner. But let's first look at the data. What has the NRMP done? So if you look at this match data, in this, what they asked the PDs, number 1, what is the most important factor that matters to you when you are sending an interview invite? Remember, this is not the same as ranking. This is different thing. This is interview invite. So what matters the most when you're selecting for the interview invite? And this is what the match data showed. So USMLE step 1 pass was the number 1 factor, and then you had MSPE, letters of recommendations, and USMLE step 2 score and personal statement. So these factors were really important. What is most interesting though is when you look at this facet of the data where they ask program directors what matters the most for ranking applicants. This is not interviewing applicants. This is after you've interviewed the applicants, what matters the most of whether they match into your program or not. So if you look at the factors that were the most important, it was number 1, interpersonal skills, number 2, interactions with the faculty during interview and visit, number 3, feedback from the current residents, number 4, interactions with house staff during the interview visit, and then you will have the step 2 score. And I wanted to see how important these factors are compared to the rest of the factors. So the point I'm trying to make across here is this: once you enter the interview, nothing else matters but your interviewing skills. How well that interview goes is the most important factor in matching. Your score, everything else generally disappears during the interview process. Nobody cares what you got on your step 1, step 2, or how well you did in your clinical rotations. All they care during that time is how well do you connect with them. And so bringing this point really home, USMLE scores versus interviews. Remember, USMLE scores can get you the interview, not the residency spot. A poor interview day is the most common cause of applicants not matching. So remember, USMLE scores are not an end in itself. They only ignite the possibility of you getting the interview, and your interview performance gets you the residency spot. An example I can give you is that I have seen many candidates who have had 15 plus interviews and they have amazing CVs. and yet they continue to fail to match cycle after cycle. While you'll see many applicants who have one interview and they have an average CV, but you will see them match in their first attempt. This is why it is the case, because the people who have the most amazing scores and a lot of interviews who don't match are probably really bad in their interviewing skills, while people who have average scores and an average profile and one interview even probably have amazing interviewing skills that they're able to show that they're a good fit to the program, and that's why they're able to match on their first attempt. So let's see how we can crack this code of being the best possible interviewee so we can be ranked to match. Let's go to the next slide. In order to understand how we can be the best interviewee, we need to backwards engineer the interviewing process so we can know how we can influence that interviewing process. If we are not aware of what is coming, what is the syllabus of the interview or how it is run, we won't have any strategy to deal with the interview, and therefore it would be hard to actually get ourselves to rank to match. So let's first understand the format of the interview. How does the interviewing format work? Number one is pre-interview social. This is the event you'll have with the residents before your interview day, and here you get to ask a lot of informal questions. So let's see what is now the format of the pre-interview social. So generally it happens the evening before the interview, where you have this lunch or dinner with the residents and you get to talk with the residents and ask a lot of informal questions, and it is a great time to connect with these residents who can then later put in a word for you. So if you remember the match data that we went through, one of the bigger factors in you matching or not is feedback from the current resident. So this pre-interview social is a very good setting where you can have that kind of casual conversation with them. Generally, the attire for this pre-interview social should be casual attire, and you should come in with some questions ready regarding the residents. Maybe it could be from the Instagram page or what they read about them, and just try to make light conversation with them. The purpose of the pre-interview social for the program themselves is to, number one, look for red flags. So to see if you do things that might be concerning to the program. An example is being overly domineering, not letting other participants ask good questions, or being overly silent on the contrary end. So they're looking for these red flags so they can screen you out and asking the residents for feedback. Second purpose of the pre-interview social for the program is to see whether how engaged you are with the program. For example, there are many applicants who avoid pre-interview socials and they don't even attend. And what happens with some of these applicants is they don't even get ranked because the program takes this as a signal of disinterest. And on the other hand, you will have occasions where many applicants who perform well in the pre-interview social and bond with the residents are given more priority than applicants who just attend the interview and might even have performed higher than the applicants who were in the pre-interview social just because of perceived interest. So they want to also check whether you are interested in their program or not by seeing if you take the time for the pre-interview social. Another purpose, I think, for you yourself during the pre-interview social is to really ask yourself, how can I start a conversation where I can get to know more about the program so I can ask better questions when especially some of the things might not be mentioned in the residency website, that you want to know some of the unique opportunities. So you can get this pre-interview social as an opportunity to generate better questions for the interview itself and then perform well in the interview. Next is format of the interview, which is interview day. So the interviews generally run for a total of 4 to 6 hours long. This is the median range. I've seen programs that also have 2 hours of total interview day, and I've seen programs that have 8 hours of interview day. Generally, 2 hours are more internal medicine or family medicine where they themselves don't have time, or it could be emergency medicine. 8 hours tend to be psych or derm, which are more relaxed. You can also have a scenario where community programs have shorter interview in the 2 hour range, and you can have formats where academic programs which are in internal medicine can have an 8 hour interview in itself, although I would bet it's rare, but generally it varies. During this time you will meet at least 3 people, which is your program director, your associate PD, which is an assistant to the PD themselves, and you'll also meet the chief resident. Generally, each interview lasts for about 15 to 30 minutes on an average, and it could be longer. I've had interviews which lasted an hour long because I was in psychiatry, but I know people who've had interviews even that were 5 minutes long. So it really varies, but generally the median is 15 to 30. The format of the interview, who you're going to interview, is going to be sent to you at least about a week before the interview. So really look at the itinerary of who you're going to talk to and research them, because this is the time when you can show that you've done your homework and you're really interested. What many people don't know about the format, the interview day in itself, is that this is the time when they first form their initial rank order list. What a rank order list means is they are evaluating your interview performance and then rating you on a score of 0 to 100. If you perform really well, you might get like a 95. If your performance is really bad, you might get a 5. So each interviewer is forming this rank order list by themselves using certain criteria, which I'll go into in the next few slides. But each interviewer is evaluating you, and all of them have their own scores on you, which will later be averaged out to give you a total ROL score for that day. After you form the initial ROL, there is group discussion that happens during the next couple of months until the February, when all of them come together and create a final rank order list where everyone sits together and basically changes a few ranks based upon whatever factors they deem is necessary. So we'll talk about those as well. So how does the interview evaluation work? There are about 4 levels of evaluations, and here is the first level. The first level of evaluation is they're going to give you a numeric score based upon the ACGME 6 core competencies. These are the core competencies that were developed by the Accreditation Council of Graduate Medical Education, which is the resident governing body. So they oversee resident education or fellow education all across the US, and they have given all residency programs directors these 6 core competencies to evaluate residents on. And these are the same competencies that our program directors all across the US evaluate all applicants on. These are basically patient care, which is how well do you take care of your patients, and your stories can tell them a lot about your depth of knowledge about patient care, and do you care, do you have empathy, those kind of characteristics as you would see here. The second core competency is medical knowledge. When you talk in your interview answers, they are going to evaluate whether you have complex knowledge of, number one, let's say the condition in itself. Number two, they're going to evaluate whether you have knowledge of the systems in the US, like the different systems that you will see. For example, I'm in psychiatry. There's something called a partial hospitalization program, which is in between the inpatient psychiatry hospital and the outpatient psychiatry hospital. So it's a transition of care. So they're also evaluating how good is your knowledge about systems in the US. The third is practice-based learning and improvement. They're going to see whether you're the kind of person who's improving, and if you improve, what is your improving process. Number fourth is interpersonal communication skills, which is how well you communicate your points to different members of the team and also the patient without possibly offending them. Also, how do you give critical feedback? How do you handle conflict? All of that is governed by interpersonal and communication skills, and I would argue this is the most important factor that matters in the success of a resident and as a physician, because at the end we have to work as a team in medicine. With the patient, professionalism, which is, do you show up at the time that you are meant to show up at? Do you dress in the attire that is deemed to be necessary for a physician to dress as? And that is basically professionalism. Lastly is systems-based practices. For example, if you improve patient care by designing a checklist which wasn't there. Initially you saw a case where you might have made a mistake, and then you came up with this PDSS cycle, implemented a checklist, and now system-wide you're resolving that mistake using the checklist. That is systems-based practices, scaling care. So they're evaluating you on all of these 6 core competencies. Each core competency could be on a scale of 0 to 17 with a total score of about 100. That is initial interview evaluation level 1. So what you could learn from this is asking yourself, if they're evaluating me in these core competencies, why don't I inject these core competencies into my answers by showing them stories which indicate that I am competent in all of these domains. Second is specialty specific review. Each of the interviewers who's interviewing you is also thinking about whether you have the traits that are necessary to be successful in that specialty. An example is for psychiatry, you need a lot of empathy, compassion, plus you have to be really good in communication, articulation, and eloquence in your language. So they're really thinking about that. While psychiatry might care about empathy and communication, if you have the same skills, empathy and communication, but you lack the decisiveness or technical skill or dexterity in surgery, nobody would care. They would rank you low, because surgery values something that is way different than psychiatry, which is again technical skill, not the same as psychiatry. So really ask yourself that how you're displaying yourself in the interview. What does my specialty really in terms of traits, and how I can best display myself in that light to what this specialty requires. So how can I cater to that demand? The third is program specific review, where they're asking themselves, if this is our culture, which could be research, innovation, or community outreach, do you match them at the same frequency of research, innovation, and community outreach? Maybe in different fractions if it is the case. Because you could be the best resident on paper, but let's say if you are more clinically oriented and the program is more research oriented, that is a mismatch, and the program is going to take account of that and is going to rank you. So what you can learn from this is asking yourself, what is the program culture like? Is it a rural program? Is it an urban or suburban program? Is it academic? Is it community? Is it university based, community affiliated? And really catering your traits and showing that facet of yourself to that program is very important. So use your answers to show that you're not just a great resident doctor, you're also the right fit for their team, and you're the right percentage match in terms of their research, innovation, community outreach to what they cater to. Beyond this program specific review, there is also an individual specific review. Remember that each program has different kinds of individuals. An example I can give you is conservatives versus liberals. Again, that might be a simplification, but every person is different. So they're asking themselves as well, like, given the individuals in our program, beyond the group fit, would this person individually fit with the PD, the associate PD, or the chief resident, and maybe the rest of the residents? So there is that process also going on while they're evaluating you, that whether you would fit individually with each one of them or not really. So really also asking yourself, how can you cater to that specific person beyond just the program, to what they need in that moment? Some people tend to be more formal. You need to be more formal with them. Some people tend to be more informal. Be more informal with them. Some people like humor, be humorous. Some people don't be humorous. So really they're evaluating whether you can cater to their own individual demands of that interviewer. Next is the final rank order list. So after they're done with the initial rank order list, after the interview, each individual interviewer will give their rank order list to the program director, and the program director will take out the average rank with the average rank order list. So let's say the PD gave you a rank, like a score of 95, the associate PD gave you a score of 90, and let's say the chief resident gave you a score of something like 70. So they will take out the average of all of this, which will close to 85. And this is your initial rank order list average score. So after this is done, the next time the rank order list is looked at is during the final rank order list meeting. This happens in Feb. And during this time, everyone in the program comes together in a room and they put all the different photos and this rank order list score of all the applicants together, and they categorize them based upon the descending orders of the scores that they have from, let's say, 1 to 100, with the person that has the highest score ranked 1, the person who has the lowest score ranked 100. They then decide whether they are going to change your rank based upon informal resident or staff feedback. Remember the pre-interview social, that is going to move your rank. So let's say if somebody ranked you at 5 and the pre-interview social really went well for you, the residents might say, hey, we really like this person, we want this person to be ranked higher. So they might move your rank from 5 to 4. Let's say if you did a successful rotation at the institution, one of the attendings might say that, hey, I worked with this person is a great fit, I think they should be ranked even higher. Your rank might go from 4 to even 3. Referral from a trusted person. Let's say somebody big in the field who everyone knows and they're very influential and they make a call to the PD. This might go from 3 to 2. The last factor is creating a diverse cohort, which is where they might have an asymmetric proportion of residents from a certain country and they're trying to balance it out with residents from another country. So let's say one is India, they might have too many Indians and they're trying to get some Turkish people, so there's diversity. So that might push your rank from, let's say, 2 to 3 again, or let's say 2 to 1 based upon whichever diversity they're trying to cater to. So these are the factors that matter during the final rank order list, and based upon that you match into that program or not. Now the NRMP also asked program directors, what are the top main reasons to not rank an applicant? And most program directors said, number 1, it was poor interview day, which is whether you were really bad, which is you were unprofessional to certain staff members, or if you showed up late, or if you used unprofessional language, that could cause you to not be ranked by the certain program. If you were, on the other hand, very neutral and you didn't even talk, you just kept your mouth shut, the program look at that as a sign of this person is disinterested, and that might cause them to not rank you at all. Bad fit. So you might be the best applicant on paper for that certain specialty, but let's say if you were too research focused for a program that is too clinically focused, focused, that is a bad fit. Lastly is professionalism concerns, which is if any resident brought up any professionalism concerns with you where you were too domineering during the pre-interview social, or there are other records of you having professional issues when you were rotating at that program, that might also cause them to not rank you. Lastly, let's talk about the levels of interviewing. There are 3 levels of interviewing that we see according to all the program directors. The first level is beginner. These are the people who know a few things and hope they won't mess up. These are the ones who you put in the interviews and they ask very little questions and they say very little because they don't know what to say or even what to ask. And these are the people who residency rejects. They are rejected over and over again because they just cannot interact with the program well. The second level is intermediate level. Here the applicants know their answers well and they can deliver a nice Q&A session, which is they can answer when the interviewer questions and they can answer again when the interviewer questions them with something else, but they cannot break beyond that Q&A session. They cannot make it more flexible where it is more of a back and forth conversation like normal conversations. The people who are the best interviewers are called as advanced interviewers, and they make the interview invisible. Because if you think about interviews that are at the highest level, they do not look like interviews. They look like conversations where it is not a Q&A session. It is a back and forth conversation between two people where, let's say, they're asking you a question and you're answering, but then you're asking them a question back and they're answering. So that is what looks like an invisible interview. And if you look at a normal conversation, this looks very much like this, because if you think about it, if your friends ask you a question and you answer, you then ask them a question back and then they answer. That is what the highest level of interviewing looks like. Breaking down advanced interviewing, this is where the interviewing becomes conversational rather than Q&A, and it feels invisible. It feels like I'm talking to a friend. It creates emotional impact. Again, people do not remember logic, they remember emotions. The last movie that you saw, you don't probably care about as much as what the movie entailed than what it made you feel. Interviews are the similar way. They care about how you made them feel. Advanced interviewers inspire the interviewer. They are so inspired themselves that the inspiration in them is infectious. Other people get infected by that inspiration. Lastly, it is also about creating a connection. Remember, when you make the conversation happen, it's emotional. There's this back and forth non-Q&A session, which is flexible, that creates a connection as if we're friends, we're already colleagues. Beyond being conversational and being able to connect at an emotional level, advanced interviewing also looks like this, where you're able to calibrate your answers to the best possible resident that they have seen, which is based upon 6 core competencies that I told you. Specialty specific calibration, where responses cater to the demands of the specialty. It's also calibrated to the level of the program. And lastly, individual interviewer calibration, which is being able to connect with the individual interviewer themselves. Another pattern that you would see with advanced interviewers is that they are emotionally relevant. And why is that important? The reason that's important is because you need emotional relevance to be memorable. If I ask you who's your favorite actor or comedian, they're probably not people who are hopefully the best looking or people who are the best in shape. They're people who have resonated with you on an emotional level. And if I ask you also, what is the first memory that you can remember about in all of your experiences, the first memory you've ever had, it's not going to be something that's just words. It is going to be something that's very emotional to you and also has some level of visuospatial data. Why is that? What is the scientific literature behind why is emotional relevance leads to more memorability? The reason is reticular activating system. This is our primary attentional network system, which focuses our attention to anything that's more emotionally relevant. Because if you look at evolutionary the past 100,000 years, what has mattered the most is this emotional system, where this emotional system is reacting positively to value and negatively to threats. So if you see something like food, you react positively. If you see a snake, you react negatively. And that is the most important factor in survival, is the emotions that come out from that and the actions that pertain. So human beings are primed for more emotional relevance than logical relevance. So the best thing I can tell you for interviewing is you do not want to be in this neutral category of being liked. Nobody cares about people who are liked. People care about people they really love and admire, or people they really hate. You technically, in an interviewing setting, you don't want to be the person like who anyone would hate, but you want to be the person who everyone would love. Another point I can make from this is that if you're telling a story, you don't want that story to be just logical. You want to add some layer of emotionality, both positive and negative. Rather, you should go from, let's say, positive to positive emotions, or negative to positive emotions, to make sure that whatever you're saying is being filtered by the attentional network system and they're registering it and remembering it. That's very critical. Now let's go to something that's even more interesting, which is the type of interview questions that you can be asked during the interview. You can be asked a total of 7 categories of questions, with the first one being the most common questions, the second one being the experience questions, third one being the behavioral or situational questions, fourth ones being personality questions, fifth one being medicine questions, sixth one being weird questions, and seventh being research questions. So let's break them down one by one. So now let's go to the most common questions. These are probably the most important type of questions, and these are 6. The reason they are so important is because you will be asked all of these questions in almost every interview that you go to. The first one is, tell me about yourself. Here they wanted to give them the cliff notes of who you are, and the formula I advocate for is going along the first, talking about your recent past. So what has been the most recent important stuff that you have done in terms of experience professionally to bring you to that residency and that matters in that residency. Then you'll go into your distant past, what motivated you to join that specialty, and what are the highlight experiences, professional highlights and personal highlights in all of your life journey that matter during that interview and will matter in the future part of your residency. And the next, you will go into future, where you will be talking about where do you see yourself going into the future. Let's say if you become a resident, what are your aspirations, what do you want to do? And that's generally the framework to answer this. This is called as the RDF framework, which is recent past, distant past, and the future. The next type of question they can ask you is why this program is basically a question to see that if you first of all have done your homework about them and if you're even interested. So that it's a screening question to see whether you would be the right kind of applicant based upon your interest in the program. Secondly, what they also want to see is how you can link your values and your future goals and aspirations to what the program provides. For example, if I want to be a child and adolescent psychiatrist, right, a good thing to talk about would be that in the program they have a child and adolescent psychiatry fellowship. So that would serve my future goal of being in this program and accelerating into a child and adolescent psychiatry fellowship. An example of value linking could be something like, since I have grown up in a very rural part of India, I would love to go to your program, which is also in a rural part. I'm very familiar with this kind of area. I really enjoy the beauty of nature and the peace that comes with these kind of settings. So that's value linking. That's what you want to show in this question is you've done your homework, you know what the program offers, and then you want to link it to your values, number one. Number two, what your future goals are. Why this specialty? Why this specialty is a question that can be asked, and what they're trying to see is whether you are serious about this specialty, because somebody who's serious about the specialty gives a very detailed answer, which is not part of the cliche that you would normally hear, because they've thought it out so well. If the answer is very vague, it shows that you're not serious about the specialty itself, because you've not thought about it. So that's kind of what they're screening is, would you be the right fit for the specialty, let alone the program? And the way you want to answer this question is, number one, you want to talk about what you enjoy about the day-to-day experience of the specialty. Number two, how you can use your strengths, which work amazing in tandem with the specialty. For example, in psych, communication is a big one. I'm good at communication. That's what people tell me. So I want to use my strengths. I enjoy using the strengths, and psychiatry is a good fit for it. So you want to talk about these two mainly, and you want to show like stories more than you want to show just vague experiences. And next is, what are your future goals? Here you want to talk about, you have thought about your future goals and aspirations, and in some way, shape or form, what you're answering here is what are your future goals with the program. So you want to link the future goals to how the program can help you reach those future goals. You don't want to list goals like, I want to be the top academic researcher in psychiatry, if your program doesn't offer that academic track or doesn't even have academics, they're community programs. So you want to link that future goal to what the program offers. The next is, what are your greatest strengths? So the reason they're asking this question is because they really want to know whether you have done deep introspection in what your strengths are, and based upon the deep introspection, you're making the right choice in terms of deciding the specialty. The way you show this in action is you first note down a specific strength, and then you talk about that strength in action. So a story, which is called as a proof point, You talk about the specific strength. For example, I have communication as a strength. I could bring up a story during the interview where I'm telling them that, hey, when I was working, let's say in a certain hospital in India, there was a big conflict in the team, and I was able to use my conflict resolution skills, and I can show them how I use the conflict resolution skills to diffuse the tense situation, and that's a proof point. So I want to talk about the strengths, the specific strength, the proof point, and how I would apply that in my future, which is called as future application. So I will take this communication, this ability to handle conflict, and apply it in the future in this residency program. That would allow me to be a great team player in order to support the rest of my residents, and also a great colleague to everyone else as well. So that's the formula, is the SPF formula for what are your strengths. The next question is, what are your weaknesses? So the reason they're asking you this question is because they really want to see if you have introspected again and you actually know what your weaknesses are. You're not ignoring them. A bad way to answer this question is by portraying your weaknesses as strengths. For example, if you like to not delegate and you're displaying that as a strength, that sometimes it's just good that I only handle it myself, because if you give it to anyone else, they'll just screw it up. That is a bad way to answer this question, because that shows that you've not introspected and you don't understand the impacts of not being able to delegate and how that could affect the team player dynamic where people could be left out. A person who has introspected will show, number one, awareness of that weakness. For example, I cannot delegate, and then they will show the consequences of what that weakness has done in their life. For example, their inability to delegate has caused team issues and slowed down their team, because of which they've had loss in productivity. And third would be what they have done to correct that weakness or improve on that weakness. And this could be something like taking a delegation course and then implementing whatever has been taught in the delegation course and then talking about the results. So that's how you answer the most common questions. I will also link down my own interview playbook that you can download completely for free, if you're interested in looking at frameworks to answer not just the most common questions, but also other questions I'll go into. The second is experience questions. These are CV based questions where they're going to dig deep into your CV. These look like, walk me through your research experience. Tell me about this rotation that you say impacted you the most because it's in your meaningful experience. What was the most challenging case you handled in this work experience that you mentioned? How did you grow from this clinical experience? The reason these questions are being asked are, number one, first of all, verification, because a lot of the times applicants do lie on their CVs or inflate things, and they just want to make sure that these are not inflated or they're not being lied to. And the way you talk about these experiences, which is in depth versus being very vague, will give a lot of information to the PD regarding the truthfulness of this experience. Second reason they're asking you is just to make sure you've introspected the most important experiences in your CV so that you can use them in future situations. The third type of questions that you can be asked are behavioral or situational questions. These look like, tell me about a time you were in a conflict with a colleague. Give me an example of handling a difficult patient. What would you do if you disagreed with your attending? So what they're trying to see is your thought process in handling difficult situations, which will probably happen in the future in your residency. And they just want to see your technique in how you handle hard situations. The way you want to handle these questions is using the STAR framework, which is situation, task, action, and result. So whatever situation happened, let's say you disagreed with your attending, what was the task? You had to come to a resolution with the attending in a peaceful way, in a non-threatening way. What was the action you took? For example, were you proactive? Did you assume positive intent by the attending that they were also just trying to help the patient if there was a conflict in the treatment plan? And did you handle that in a calm, peaceful way with technique, using empathy, using compassion, and come to some kind of conclusion where both of your needs were met? And the result, what was the result of your action, which is whether both of you, you and the attending, were you happy, or both of you were not really happy or sad? Let's go to the next one, personality question. This is just to see what kind of a personality you have and would you be the right fit for their personality. These are questions like, what motivates you? Who are your role models and why? How would your friends describe you in 3 words? What would you like to do outside of medicine? If you weren't a doctor, what would you be doing? What they're really also looking for is whether you're a human or you a machine, and you want to show them your human side. You want to be very friendly in answering these questions. Something that really helps is wit and humor. If used right, I think these are superpowers. If you have them, please use them in these personality questions. You don't want to be overly rigid. You want to be very flexible with answering these questions. Next is medicine questions. These look like, how would you manage a patient with chest pain? What's your approach to a patient with acute confusion? How do you prioritize the patient in a busy ER? Tell me about a challenging diagnosis you made. So there are a lot about medical knowledge. These are very rarely asked. The reason for that is the fact that you're in the interview. If you didn't have enough medical knowledge, which was proven through your steps, you would probably not be sitting in the interview. So your medical knowledge is already assumed. And so therefore, the most of the interview isn't about screening for medical knowledge. It's screening out for red flags and screening in for the fit that they want to do. So just don't be that worried about these as much as the other questions. Next is weird questions. So these questions look like, if you were a fruit, which one would you be and why? How many tennis balls fit in a school bus? So the common component you are seeing here is that they're out of the blue and they just shock you almost. And some of them are very hard to answer. But with these, what they're trying to look for is what is your cognitive processing speed like? And how do you respond to unpredictable situations? And a lot of these situations you're going to get in residency, and these kind of give them a hint because nobody can prepare you for any of these questions. And seeing your response, if you have wit, if you can be creative, that gives them a lot of insight into who you are beyond your medical knowledge. Next is research questions. These look, tell me about your research project. What was your role? What was the main finding from your study? How did your research impact your understanding of clinical medicine? What challenges did you face and how did you overcome them? If you could design a follow-up study, how would you change or explore further? What they just want to know here is, again, verify the experience, because a lot of the times people fake their experiences and they're not really real. So they're looking for depth of knowledge about the research area. Second, they're looking for is introspection. They're trying to look for is whether you're getting these publications or research experiences because you actually care about research, or is it that you're just trying to build publications and trying to get into residency or just inflating your CV? Because the response to this question tells the person a lot. So really think about how you're going to answer these questions because they're very, very important, and program directors really rate your responses to these high, especially in the academic programs. Next, so congratulations to anyone who stayed till the end. My first gift to you is I'll be giving away my residency interview question bank, which is about 400 plus questions for completely free. This has been the fruit of about 3 to 4 years of research, and now it is yours for free. So I'll be mentioning this in the description along with the code to get it for free. The code is going to be 19 off, and it will take about $19 off from the question bank, so it will make it free. The second gift I have for you is a whopping 50% off my most followed advanced interviewing course for residency interviewing, which is designed to make your match inevitable into your number one choice of residency on your first and last attempt. You can use the code MATCH50 and get a 50% off on this. In this course, I will be taking you through almost all possible interview scenarios and how to answer every possible interview question they can throw at you using my own proprietary frameworks that I've developed over years of training residents on how to interview. I'll also be teaching you how to handle COBOL questions, research questions, and apart from that, red flag questions. Additionally, I will also teach you different models on supercharging your charisma and the connection you derive from that charisma so that you can appear as a fit to all programs. 2,900 plus applicants have used this course and successfully matched into their dream residencies. Apart from that, our match success rate is 97.2%, which is unheard of in the whole residency interviewing process. And you can also hear from my students who talk about their experience. But this also comes with a match guarantee, which means that if you use the course and for some reason you don't match, which almost never happens, but let's say if you don't match after your interview, we'll give you your money back. This is just to show you how much trust I have in this system, and you, if you use that system, that you will match. So hopefully you had a great time, and just check out the links. Thank you for watching. I'll see you in the next one.